Welcome to our ERC Virtual Meet the Expert session, where I am pleased to host Carsten Lott, who is co-chair of the ALS Science and Education Committee. Hi, Carsten. Education in CPR is crucial for the survival of patients in cardiac arrest. What is the impact of the current crisis on our education program?
Yeah, hi, Nicholas. I'm happy to be part of that process. At the moment, there's only minimum activity throughout the ERC family. The pandemic has changed many of the basic conditions for our daily work, including social distancing. And we need to do that to a varying amount within the ERC member countries. Most of the candidates and instructors in our ERC courses are important for our healthcare systems. And there are a lot of activities at the moment to prevent these from becoming infected themselves. Avoiding meetings in teams for training purposes is part of these measures. This in contrast to the need of high quality training, especially in demanding times as at the moment, has led to uncertainty. With our COVID-19 related guidelines, ERC provides guidance for all healthcare providers.
Okay, what are the possible alternatives with regard to CPR training basic courses, Carsten?
So there's still a big number of patients out there suffering cardiac arrest for non-COVID related reasons. Early help, including basic life support, has the potential to save many lives. Education in CPR is crucial for the survival of patients in cardiac arrest. Therefore, life support teaching programs need to resume as soon as possible. These life support teaching programs must include specific interventions for COVID-19 patients, focusing on infection prevention, whilst being adaptable for local needs and requirements. During the pandemic, the ERC does not recommend face-to-face hands-on BLS teaching for lay people, and especially no mass training. The ERC recommends individual self-directed learning, apps and virtual reality resources for basic life support, as these are already available and proven to be effective to learn chest compressions and the use of an AED. To minimize the risk of infection during that life-saving help, no check of respiration and no ventilations will be taught for lay people. On the other hand, professionals who have to provide BLS regularly should be educated in donning and doffing of personal protective equipment, chest compressions, use of an AED, and back mask ventilation with a high efficiency particulate filter between the mask and bag. Practice in small groups with PPE should be possible.
Okay, thank you for that very clear answer, Carsten. But what about the recommendation for advanced courses?
So for advanced courses, the life support teaching programs must include specific interventions for COVID-19 patients, focusing on infection prevention whilst being adaptable for local needs and requirements. It's the same as in basic life support. So self-protection and measures against infection, and this means equipment and procedures, have to be part of our CPR education. On-site teaching facilities need to be modified to avoid virus transmission. Guidance on these modifications is part of our guidelines. Whenever possible and where applicable, teaching methods like distance learning, self-directed learning, augmented and virtual learning should be implemented. Beyond the current team training, specific education on human factors like briefing and debriefing and restriction of leadership and communication wearing PPEs during CPR and the pandemic should be provided as hands-on training in small group teaching sessions. Training of special circumstances should include the pandemic and comprise the management of in-hospital cardiac arrest in the prone position.
Thank you, Carsten. And I have just one last question. What is the position of ERC concerning instructor education and certificate validity?
So this is a bit more complicated because instructor education in the form of the ERC basic instructor course or our generic instructor course should be paused during the pandemic, as these courses are not essential for patient care. Information about teaching BLS and advanced life support during this pandemic will be provided to ERC instructors, course directors, and educators in reading and in internet-based sessions. Looking at the certificates, the validity of all ERC certificates has already been extended for 1 year to reduce pressure on candidates and instructors. Overall, restarting ERC courses will support patient-centered care, but needs to be in accordance with the local healthcare orders, the incidence of SARS-CoV-2 infections, and the availability of PPE.
Okay, thank you very much for your time, Carsten.